info. I'm going to scan root. Okay, and there's my little instrument desk. And this is my visit card. Okay, alright, let's do it. Okay, so hello, my name is Ann Vo, and I am a family nurse practitioner student from UTA, and I'm here with my patient Janie, and we're going to be doing a physical head-to-toe assessment today. Is that all right?
Yes.
Okay, wonderful. So I'm going to go ahead and wash my hands. Okay, first I want to go ahead and observe her general appearance. She appears clean, well-dressed, well-kept. What is your name?
My name is Janie.
Okay, and what is today's date?
Today's date is March 23rd.
Okay, and who is president today?
Donald Trump.
All right, and where are you at?
I'm at home.
Okay, so patient appears alert and oriented, answers all questions appropriately, and her communication skills are adequate. So first off, we're going to inspect her skin. Skin seems uniform, appropriate for ethnicity, no lesions or edema noted. Skin is warm to touch, smooth and dry. I'm going to assess the skin turgor here. It is resilient, no signs of dehydration. Okay, so I'm going to go ahead and inspect your fingers. If you can put out your fingers for me. Upon inspection, fingernails are pink, opaque. They are short, uniform, and well kept without any deformities. No redness, swelling, no signs of cyanosis. I'm going to go ahead and palpate for capillary refill. And while I'm palpating, are you feeling any tenderness right here?
No, I'm not.
Okay, good. Capillary refills are less than 3 seconds. If you can put your fingernails together like this, okay, no clubbing noted. All right. And then next, I'm going to take a look at your hair. So, hair appears evenly distributed with a female pattern. It is thick, long, no signs of baldness, no uneven surfaces or anything like that. Upon palpation, it is fine, no breakage or any of that sort. I'm going to go ahead and palpate the scalp overall. Scalp moves freely, no depressions, it is smooth, and no deformity is noted. Okay, so I'm going to go ahead and inspect her head. Head is round, normal cephalic, it is symmetrical. Facial features are symmetrical too. No discoloration or variation there. I'm going to take a look at her neck. I'm going to observe laterally for any enlargement or mass. I'm not seeing any, but I'm going to go ahead and palpate while she swallows. If you can, do you feel any tenderness right here?
No, I don't.
Okay, go ahead and swallow for me. Okay, wonderful. The thyroid gland seems to rise freely with swallowing. There weren't any nodules or tenderness upon palpation. I'm going to go ahead and take a listen for any bruit. Okay, no bruits heard upon auscultation. I'm going to go ahead and check the trachea. The trachea appears midline. I'm going to check right here, and it doesn't deviate to any side. And the carotid pulses, I'm going to go ahead and palpate bilaterally, one at a time. Okay, carotid pulses are +2, and I'm going to go ahead and check for bruit there as well. Okay, no bruits at all. All right, thank you. So that was, and I'm going to go ahead and check for any lymph nodes. Now I'm going to check lymph nodes bilaterally at the occipital, pre-auricular, post-auricular, tonsillar, submandibular, submental, interior cervical, posterior cervical. go ahead and clench your shoulders ahead. I'm here. I'm going to check for supraclavicular. Okay, you can relax. And I'm going to go ahead and assess for axillary nodes. And then go ahead and lift your shirt off for me. Let's go ahead and take it off. So axillary. Okay, and epitrochlear. All right, did you feel any tenderness while I was palpating?
No, I did not.
Okay, so no tenderness noted bilaterally to all lymph nodes. Okay, so we're going to go ahead and start with the eyes. So upon inspection of the eyes, there are no edema noted, no flakiness, no redness. Eyelashes are present bilaterally. The eyeballs appear round. The conjunctiva is pink, moist, intact. Sclera is white without any noted jaundice or plaques. The lens is clear. Iris are brown. Pupils are equal and round. There seems to be no edema noted to the lacrimal appomatous, and eyebrows are full. Everything seems pretty good there. So we're going to go ahead and test your vision. There's two types of charts that we can test for. The Snellen chart, it tests for far vision, and this is when you'll have to stand 20 feet away. But today we're going to test your vision using the Rosenbaum, okay? So go ahead and hold this for me. I'm going to measure 14 inches out. Okay, right here. And then cover your right eye. Go ahead and call out the smallest number that you can read.
Okay, it's 638 EWE.
Okay, now cover your left eye.
Okay, it is 8745E.
Okay, good. So based on that, it looks like patient's visual acuity was 20/20, which is good. Okay, so now we're going to take a look at the inner part of your eye. Okay, so I'm going to hold, stand back about 30 centimeters and look for the red reflex. I'm going to brace here and move forward. And look at the inner eye. Okay. So upon inspection of the inner eye, I see the optic disc. Its margins are sharp and well defined. It's cream colored. The macula is also present, about 2 disc diameter temporal to the optic disc. I don't see any lesions. The blood vessels are present. There's no hemorrhages noted. Seems everything is good in there. Now we're going to do the left eye, and I'm going to go left eye to her left eye. Okay, so I'm going to test for red reflex. Go ahead and brace and move forward. Okay, so upon inspection of the left eyelid, the left inner eye, I also saw the optic disc as well. Its edges are well defined and sharp. The macula is present without any lesions, no papilledema noted, no hemorrhages, no no mass noted there as well. Okay, so we're gonna go ahead and check for pleura. So we're gonna go ahead and dim the lights. We'll dim the lights. Okay, so I'm going to check for consensual and direct reflex. Going over the right side, I'm going to check for constriction and also check for consensual constriction of the left eye. And then we're going to do the same thing with the left eye. Direct constriction with the left eye while checking right consensual constriction of the right eye. Okay, so I'm going to stand at 30 centimeters out. I'm going to point this light at your nasal bridge, and I'm going to check for symmetry of the light reflection. It is symmetrical. Okay, so I'm going to go ahead and ask you to stare at this pen as I move closer to you, okay? All right, patient is able to accommodate and constrict. As a result, patients' pupils are equally round, responsive to light, and accommodate. Okay, so next we're going to check for the uncover cover test. Okay, so go ahead and focus on an object on that wall right there. I'm going to cover one eye. I'm going to observe for any strabismus. Okay, keep staring straight ahead. All right, no strabismus noted. And now I'm going to go ahead and assess for the 6 cardinal extraocular movements with the 6 cardinal fields. So with your head straight, I want you to stare at this pen. Don't move your head. Okay, so patient was able to follow all 6 cardinal fields without any nystagmus noted. Okay, so let's see. Okay, so next I'm going to go and take a look at your ears. Upon inspection, I see that the top of the auricle is in line with the inner canthus. I don't see any lesions, any edema, erythema, redness, and I'm going to go ahead and palpate, okay? Palpate the outer pinna. Do you feel any tenderness here?
No, I don't.
Okay. I'm also going to palpate the mastoid process as well. Do you feel any tenderness there?
No, I don't.
Okay, good. So now we're going to take a look at your inner canthus. Okay. So I'm going to go ahead and brace. Pull the pinna back. Insert and observe. So to the patient's right external canal, I saw that there was no foreign bodies, no discharge. It is patent. Tympanic membrane was also observed. It is pearly gray, intact, has a conical appearance, and does have a 5 o'clock light reflection. So I'm going to do the same thing with the left ear as well. I'm going to go ahead and brace, pull the pinna back, insert, look through. Okay. So upon inspection of the left ear, the external canal was also free of foreign bodies, no discharge noted. It is patent. The tympanic membrane was visible, also conical, pearly gray. Everything was intact, no erythema, and with a 7 o'clock light reflection as well. Here, I'd like to go ahead and test for the whisper test. If you could face that way for me, cover your left ear, and I'm going to whisper something, so you'll have to repeat it.
Hamburger.
Okay? Now cover your right ear, and I'm going to whisper something.
Ice cream.
Okay, good. Awesome. I'm going to go ahead and test using the Weber and Rhine. This will test for equilibrium and lateralization, okay? You let me know if you hear the sound more on one side or equal.
Okay. It's equal.
Okay. Now we're going to go ahead and do the Rhine test, which tests for air conduction and bone conduction. You let me know when you stop hearing the noise.
Now.
Okay. So for demonstration purposes, the time has been decreased, but it shows that the air conduction was heard twice as longer than the bone conduction, which is expected. Now we're going to do the same thing with the patient's left side.
Now. Now.
Okay. So air conduction was heard twice as longer than the bone conduction. Okay. So now we're going to take a look at her nose. Nose appears midline, no deviation to any side. Go ahead and palpate here. Do you feel any tenderness?
No, I don't.
Okay, good. And with a clean speculum, I'm going to go ahead and take a look inside her nair. Okay. So with my left hand, I'm going to go ahead and brace. Oh, I'm sorry, with my right hand, brace. Tilt your head back for me. I'm going to take a look inside your nares. So patient's right nair appears patent. The mucosa is pink, intact. There weren't any nasal polyps noted, and the turbinates are also deep pink. Now, assessing her left nair, I'm going to go ahead and brace her. Look. Okay, so also looking through the patient's left nair, it is also patent. Mucosa is also pink and moist. Turbinates was also deep pink skin color as well. No nasal polyps noted and no discharge bilaterally. Now, I'm going to take a look at her lips. Her lips seem symmetrical, no lesions noted, no signs of cyanosis. Let me go ahead and feel. Okay, it's smooth, no signs of dehydration either. If you can open or clench your teeth for me, I'm going to take a look at your gums. Gums are firm, pink. Teeth is no decayed teeth, all is present, 32 teeth is present. Go ahead and open your mouth. I'm going to assess the floor of the mouth. Okay, the floor of the mouth has the frenulum intact, midline, no ulcerations or lesions noted, no white patches. Buccal mucosa is pink, moist, and intact. Go ahead and open up. Stick your tongue out for me. Midline. The tongue is midline, no deviations to one side, no vesiculations or tremors. Go ahead and stick your tongue out and try to touch your nose. Try to touch your chin. Go side to side. And then just real quick, since we're here, through the cheek, push my finger. All right, push my finger. Very good. Okay, now we're going to take a look at the back side of the throat. Open up for me. I'm going to take a look. Say ah. Okay. It's a little dark, so I'm going to go ahead. Okay. Say ah. Okay. Uvula rises midline, rises freely. Tonsils are not inflamed, no exudates there. And then I'm going to test your gag reflex, okay? Ooh, okay. So gag reflex is present. Alright, so I'm now going to go ahead and take a look at your I'm going to take a look at your chest now. Okay? So looking at the patient's chest, there doesn't seem to be any, patient's chest is even. The AP diameter is shorter than the lateral diameter. I see no retractions here. The landmarks are present. The clavicles are prominent superiorly, and the sternum is flat. Okay. Patient's breathing rate seems even. I've been counting for 30 seconds while I've been talking. It seems to be 16 breaths per minute, unlabored, even, no stridor heard. And I'm going to go ahead and percuss, okay? So to the interior, there's going to be 8 spots that I'm going to be percussing. And you want to percuss bilaterally. And just pull underneath. Okay. And I'm also going to percuss 8 lateral sides, 4 on each side, and you want to do that bilaterally as well. If you can, go to your posterior side. I'm going to take a percuss, and you want to percuss bilaterally as well, avoiding any clothing, any the scapula bones. Okay. So it was resonant noise heard upon percussion to the chest bilaterally. Okay, so if you can go ahead and turn around, I'm going to go ahead and take a listen to your lungs. Oops. Okay, it's still going.
Okay. So go ahead and take a deep breath as I place it on. And you want to auscultate bilaterally. Here you'll hear bronchial sounds. And as you descend, you'll hear bronchial vesicular. And down here, you can listen to for vesiculars. And that was 8 spots anteriorly. You also want to listen 8 lateral spots as well, bilaterally. Okay, and now I'm going to take a listen to your backside. All right, and you want to listen here bilaterally as well. Vesicular, vesicular. It is at this place right here that you'll hear bronchial vesicular. And then you'll go back to vesicular sounds. Okay, go ahead. While we're here, I'm going to go ahead and assess for tactile firmatives. So whenever I place my palms on you, just go ahead and say 99. Okay, go ahead.
99, 99, 99, 99, 99.
Okay. Firmatives was heard upon palpation, and also lung sounds were clear to auscultation bilaterally, posteriorly, laterally, and anteriorly. Okay, go ahead and turn back around. I'm going to take an inspection on your heart now, okay? So upon inspection, I don't see any, real quick for the lungs, I don't see any retractions either, and her breathing rate was unlabored. Okay, so now back to the heart. The heart, I don't see any heaves, any thrust, any lifts. I'm going to go ahead and palpate the pericardium. And you can palpate for the apical pulse down here. You can also visualize it too if the patient is skinny enough. The apical pulse is palpable, and it is +2. Okay, so I'm going to go ahead and take a listen. With the bell, you're going to hear low-pitched noise. With the diaphragm, you're going to hear high-pitched noise. So here, with the diaphragm, at the right second intercostal space, at the right sternal border, you're going to hear the aortic pulse. The left second intercostal space, at the left sternal border, you're going to hear the pulmonic pulse. If you go down lower to the left third intercostal space, at the left sternal border, you'll hear Erb's point. And then left fourth intercostal space, at the left lower sternal border, you'll hear the tricuspid valve. And lastly, at the left mid-clavicular line, at the fifth intercostal space, you'll hear the apical or the mitral pulse. And you'll listen here for a minute. Pulses are heard upon auscultations. It is 60 beats per minute, normal sinus rhythm, even, consistent, no murmurs, no gallops, no rubs, no splitting heard upon auscultation. And you can also assess the heart, do the heart assessment while the patient is sitting, while they're lying down supine, or left lateral recumbent. Okay, so now we're going to move on to the blood vessels. Okay, so bilaterally, I will assess for the temporal vessels here. Okay, brachial, radial, here, I can assess for the dorsalis pedis, and then behind the ankle at the posterior tibial. All right. Pulses are palpated bilaterally. It is equal, +2 as expected. Let's see. And then now we're going to move. Oh, I'm going to go ahead and take a look at my little card. Okay, so moving on to the abdomen, go ahead and lay back down for me. Upon inspection of the abdomen, I'm looking at the shape of it. It is flat. The skin color is uniform to the rest of her body. It is smooth without any lesions. It rises up and down with respirations. And I'm going to go ahead and percuss. Okay? So, I'm going to percuss in all four. Oh, no, sorry. I'm going to go ahead and auscultate first. I'm going to go ahead and auscultate with my diaphragm in all four quadrants. Epigastric region. Switch over to the bell. Okay. Bell sounds are heard upon auscultation in all four quadrants. There were no bruits heard upon auscultations. Now I'm going to go ahead and percuss. Starting with the right lower quadrant, right upper quadrant, left upper quadrant, right upper quadrant, left upper quadrant, left lower quadrant, epigastric region. Okay. All right, so tympanic sounds were heard upon percussion, and I'm going to go ahead now and percuss for the liver span. Starting at the umbilicus, I'm going to start from tympanic sound to dullness. Okay. And with a marking pen, I'm going to go ahead and mark here. Now at the third intercostal space on the right mid-clavicular line, I'm going to go from dullness to tympanic. Now using a measuring tape, I'm going to go ahead and measure. And it looks like it measures about 7 centimeters, which is within the expected range. Now, I'm going to go ahead and percuss for splenic dullness in the left upper quadrant. Okay, splenic dullness is palpated, splenic dullness is present in the left upper quadrant upon percussion. Okay, so now we're going to do a light palpation in all 4 quadrants. Do you feel any tenderness as I'm doing this?
No.
Okay, good. All right then, no tenderness noted in all 4 quadrants upon light palpation. Now we're going to do deep palpation. We're going to check for any masses. You alright? Mm-hmm. Okay, good. Okay, if you can go ahead and sit up for me. I'm going to check the CBA tenderness here. Alright. Let me know if you feel any tenderness.
No.
Alright, good. Okay, now that we're done with that aspect, I'm going to ask the patient to stand up and we're going to check for musculoskeletal. Alright. Patient stands posture is erect, and if you can, go ahead and walk that way, walk away from me and then back. Patient's gait is steady and even. If you can bend down, touch your toes for me. Okay. So looking at the lateral, I see no rib humps and there's no lateral curvation. Go ahead and stand up. Okay. And then upon inspection, I see the shoulders, the scapula is aligned with the iliac crest. So no signs of scoliosis there. Okay, very good. Now we're going to go ahead and do our range of motion. Go ahead and just keep your chin to your chest. And now look up to the ceiling. Now rotate right to left. Now hug your right ear to your right shoulder and vice versa. Okay, patient has full active range of motion to the cervical spine. Now we're going to do the shoulders. The shoulders, go ahead and shrug your shoulders like this. Put your arms at your side and raise forward, up over your head. Go back down to your side and move backwards. All right, keep them at the side. Take your right arm and go in front of you to your left, okay? And then go back up over your head like this. Okay, good. While we're there, go ahead and tuck that hand behind your head too. Okay, good. Now put it back down. Now we're going to go with the left side. Left side across your chest, up over your head, and then behind your head. Okay, back down. Now we're going to take the right side and go behind your hip. Place your hand behind your hip. Good. And now we're going to do the same thing with the left side. Okay. So patient has full active range of motion for the shoulders. Now we're going to do the elbows now. If you can go ahead and put out your elbows like this. Flex your elbows for me. Extend, pronation, and supination. And then I'm going to go ahead and do a passive range of motion. Okay. Patient has active and passive range of motion bilaterally to the elbows. To your wrist now. Let's go ahead and put your arms out. Flex your wrist like this. Hyperextend your wrist. Put it to midline. And turn your fingers towards each other and turn your fingers outwards. Okay, good. Patient has bilateral full active range of motions to her wrist. Now her fingers. Flex your fingers like this, like you're making a fist. Extend them out. Abduct your fingers and put your fingers together like this. Okay, good. Now flip them over and just kind of touch your thumb to all four fingers. Okay, so patient has full active range of motions of her phalanges. Now we're going to do the hips. If you can lie back down for me. Okay, so keeping this right leg the right knee extended, go ahead and lift your leg up. Now the left. Good. And then right leg, pull it away from your body. Okay, and I'm going to hold this as you go the other way. Okay, good. Now let's do the same with the left foot. Left hip. Left hip. Okay, good. Now we're going to go ahead and flex this knee right here. Go ahead and turn your knee outwards. Turn your knees inwards. Okay. And then go back down. Now this one, outwards, inwards. Okay. Down. All right. And if you can, go ahead and flip on your belly. And we're going to hyperextend your hip joint. So go ahead and lift. Good. Lift the other one. All right. Thank you. Patient has full active range of motions of her hips. Now we're going to move on to the knees. Go ahead and stand up for me. All right, we're going to go ahead and flex the knee like this, extend. Now with the other one, flex the knee, extend. Okay, good. And then I want you to lay back down, or sit back down here to kind of put your knees on top. We're going to do the ankles now. So point your toes to the ground, okay? And point your toes to the surface, the ceiling. Now, invert your ankle towards each other. And evert your ankle away from each other. Okay, good, thank you. Patient has active range of motion, full active range of motion to her ankles. All right, so now we're going to test for the cranial nerves. Okay, So cranial nerve number 2 is the optic nerve. This was a test for visual acuity, and this was demonstrated earlier using the Rosenbaum and mentioned by the Snellen chart. Cranial nerve number 5, which is the trigeminal. This is to test for facial muscles, and this is also to test for sensation to the eyes. And we're going to do this by asking the patient to clench her teeth, okay? And then with a Q-tip, I'm going to test for patient's reflex as I approach her. Patient should be blinking. Okay. All right, so cranial nerve number 7 is the facial nerve. This is to test for symmetry upon facial expressions as I ask the patient to smile for me, frown, wrinkle your face, raise your eyebrows, poof out your cheeks. Okay, thank you. And then cranial nerve number 8 is the acoustic nerve, and it tests the hearing and equilibrium. And this was tested earlier when I did the whisper test, the Weber test, and the Rhine test. Now, cranial nerve number 9 is the glossopharyngeal. This test for the gag reflex and the swallowing, pretty much motor movements. And then cranial nerve number 10 is the vagus nerve, and this will also test for the smooth muscle associated with the gag reflex. The gag reflex was already assessed earlier and was intact. She did not have any trouble upon swallowing, and when I assessed her throat, her uvula remained midline and rises upon phonation. Cranial nerve number 11 is a spinal accessory, and this one will test the shoulder and neck strength against resistance. So I'm going to ask the patient to shrug while I push down on her. Okay, and then push against my hand. All right, and then push against my hand. Okay, good. So, and then lastly, cranial nerve number 12, the hypoglossal. This one was demonstrated earlier when I asked the patient to stick out her tongue. She was able to move her tongue up and down, side to side, pushed against the finger. So, yeah. All right, so now we're going to test your motor functions. Go ahead and pat your knees and alternate with your hands and your palms and go faster, faster. Okay, good. Patient has rhythmic alternative movements with increasing pace. Now, I want you to close your eyes, put your arms out, and touch your nose with alternating fingers. Okay, faster, faster. Okay, good, you can stop. Patient was able to demonstrate that she has rhythmic alternative movements with increasing speed. Okay, so now we're going to go ahead and test your sensations. So with the soft sensation and a hard sensation, I'm going to ask, this is soft and this is hard, I'm going to ask her to differentiate between soft and sharp and where she's feeling it. So go ahead and close your eyes.
Soft right forearm. Sharp left forearm. Sharp right foot. Sharp left foot.
Okay, wonderful. Patient was able to differentiate sensations on upper and lower extremities. Now we're going to test for vibration sensation. Let me know where you feel this vibration, okay? Close your eyes.
Right elbow. Left elbow. Right knee. Left knee.
Okay, thank you. Patient was able to feel that vibration. Okay, so now we're going to go ahead and check your reflexes, okay? So we're going to start with the bicep reflex. Okay, and we're going to test it bilaterally. Okay. Now we're going to move on on to the triceps reflex. We're going to do that bilaterally as well. Okay. All right, now we're going to move on to the brachioradialis reflex. Okay. Now we're going to do the patella. I'm going to support your knee here. Okay, thank you. And now we're going to do your Achilles. If you could go ahead and put your ankle up here to demonstrate. I'm going to hold her foot here. Go ahead and check. Okay. All right. So now we're going to do the plantar reflex, where I kind of scroll the lateral aspect of her foot. All right. Her toes were able to flex. The other side. Okay. Thank you so much. There are a couple of tests that we still need to do. First, I want to go ahead and assess your maxillary sinus and your frontal sinus. Upon inspection, there doesn't seem any edema or any swelling noted. I'm going to go ahead and palpate, okay? Do you feel any tenderness here?
No.
Okay, no tenderness upon palpation to bilateral maxillary sinus and frontal sinus. Here, I'm going to do a transillumination test. This is to check for patency of the sinuses. Go ahead and tilt your head back. I'm going to go ahead and brace and put this lateral to your left side. Open up your mouth. And I see transillumination through the roof of her mouth. Now we're going to try the right side. Lateral here, open up. And I also see transillumination to her roof of her mouth as well. This indicates that the sinuses are patent. Now, so I'm going to go ahead and ask you to stand up. We're going to do the Romberg test now. Go ahead and close your eyes. All right, patient was able to correct herself and has balance. Go ahead and lay back down on your back. We're going to do the Murphy's sign. So I'm going to ask the patient to inhale while I cuss my fingers underneath her right rib cage. She should feel no pain. Inhale for me. Okay. Negative. Patient is negative for Murphy's sign. Now I'm going to go ahead and do the anterior drawer test. Flex this left knee for me. Okay, no movement indicated here. And then now this side. All right, no movement indicated here. Okay, so transillumination, Weber and Rhine was already assessed. The Romberg test was just assessed. Anterior Murphy sign, and there is one more. I'm going to go ahead and review my note cards, okay? Oh, and the front. Okay, that concludes our assessment. Thank you.